Truly, over the past 11 years, more and more information has come out in the media about women and hair loss and the fact that women don't have to put up with this or put on a wig and just feel that there's no solution. So when women have hair loss, there's a variety of reasons. There could be thyroid disorder, hormonal imbalance, emotional, physical stress, a variety of things that even medications can contribute to their hair loss. It's different than men's hair loss. Unlike men who start to lose their frontal hairline, women's hair loss is diffuse, which means it's scattered, usually all over the top of the head, which then gives them a see-through appearance to their hair. Differences between men and female are quite significant in my opinion after 11 years of working with women who have lost their hair. For men, it is very socially acceptable. It's very common to see a man who's got a receded hairline or a bald spot in the back of their head, but for women, to have hair that's now see-through, it's not vibrant, it's not full, it's not wavy, it really takes away from their self-esteem. Many women will buy wigs that don't always look very nice or they don't look real, so it really starts to impact them in terms of how they feel in regards to their outward appearance, their confidence, their femininity. How can hair loss be remedied? There's several ways that hair loss can be remedied. First of all, the most important thing for females is we have to figure out, why do you have hair loss? Is it related to your hormones, be it estrogen and progesterone? That would be one of our first tests we would look at. We would also look at your thyroid level. If you have a low thyroid, we know for a fact that when a person is hypothyroid, they can start to lose their hair or get thinning hair. If you are significantly anemic, which means low iron counts, that could also contribute to hair loss. If you're under a good deal of emotional or physical stress, maybe due to illness, those two reasons can also contribute to hair loss. So first and foremost, figure out what's going on here if we can figure out a source. Perhaps it's genetic, your mom, your grandmother, your aunt all had this, and there is no underlying medical condition. So once we determine that, then we put together a plan of care. At a female's initial consult with Dr. Quatela, all of those questions are asked in terms of your medical health history to figure out if we know why you're losing your hair. Usually, if labs have not been done, we will send you back to your primary care physician to have all those labs performed, so then we can evaluate those results. So that would be the first step. Many women come to us and they've already seen their family doctor or even their OBGYN, so they already know that all of those medical conditions are stable and that there are no problems. So then at that point, the next step is to assess how much hair loss are we seeing, what is the density of the hair behind the head, because your hair that's back here in what we call the occipital area is genetically programmed to stay. So whatever density you have here, whatever color, thickness, softness of your hair, all of that takes into play what we can transplant to the top of their hair. So that would be the next thing that we assess. Once we assess that you are a good donor, that you have good hair in the back of your head, then we decide how many grafts will it take to fill this area to make a person happy with those results. And that is certainly determined by Dr. Quatela. Once the hair is transplanted, it will take 4 to 6 months for them to appreciate any hair growth. And from that point all the way to 1 year, hair will continue to come in. Truly, it takes a full year for you to see your final results. The recovery time for a hair transplant typically is only a few days. You certainly feel pretty good. You have minimal discomfort, although we do prescribe a narcotic for the first 1 to 3 days, because if we do make an incision on the back of your head, that will feel tight and it will feel sore. Many people will take the next day off, regardless of the technique that we use, just so they have a day to rest, recover, feel a little bit better, and then you truly can go back to work the following day. So take off the day of the procedure the next day and go back to work the following day. We do ask you not to exercise for 1 week after, because that can contribute to more swelling and discomfort. In regards to if other people can tell if you've had a hair transplant procedure, certainly your significant other, your family members, a close friend would notice this because they know you, they see you all the time. However, if you have dark hair or have relatively good hair coverage, no one should actually notice anything was done. If you have blonde hair or particularly very thin hair, For the first few days, you will have a multitude of tiny little scabs in the area that the hair was transplanted. If that was the case, then I would certainly recommend taking 4 or 5 days off, which will give the body time to get rid of those scabs, and then underneath the scalp will just be lightly pink, and quite honestly, most people do not notice that. So how does a woman know if she's a candidate for follicular unit transplantation or follicular unit extraction? Truly, she doesn't. She won't know that until she sees Dr. Quatela, and then Dr. Quatela will then assess the amount of hair loss, assess your concern, and then based on his 25 years plus experience, he will then decide what would be the best approach to give you the best results. Common feedback we receive from female patients is indeed they wish they would have done this sooner because they had years of suffering or years of feeling less than confident in regards to the appearance of their hair. So if you've decided that you'd like to further research hair loss and treatment, I would encourage you to call our center at 244-1000 to make an appointment with Dr. Quatela for a hair consult, or you could choose to go onto our website at quatelahair.com to see before and after photos, as well as to learn more detailed information that we have placed on our web for you.